Perfect. Thank you. Ladies and gentlemen, welcome to today's discussion. I know we just celebrated and commemorated World TB Day on the 25th, I believe, but we're looking at having a post-World TB Day discussion. A lot of people did a lot of things. There's been a lot of activities, and kudos to all the people that actually came out in numbers to commemorate this particular day. My name is Miss Lizzie Otai. I'm a development communications consultant, and I'll be your moderator for the next 1.5 hours. So looking forward to just having, a candid discussion on how we can rethink the whole Stop TB strategy by 2030. First of all, before we kind of carry on, I'd like to appreciate all the speakers who have joined, but also all the delegates who were either from the civil society, communities, or are actually directly impacted by TB, but also TB advocates and champions. So welcome and looking forward to just interacting with you through this session. And also, we would like to extend our appreciation to the partners. Of course, when it comes to advocacy, we've noticed that we need masses and masses of people if we are to eradicate TB by 2030. So thank you very much to ACT Africa, TTC and Tanzania, Stop TB Partnership, Developing Countries NGO Delegation, of course, the Learning Hub that Ian also hosts for the Global Fund, that's the Anglophone Africa Regional Learning Hub, and Global TB Caucus. So thank you very much for your partnership, and we look forward to just strengthening this kind of strategic collaborations in the future. The next slide, please. Yes, and I also want to give kudos to the team at the back who are also running the slides. So thank you, Linda and the team. This is a webinar. Of course, we have to go through the housekeeping rules just to make sure we're all on the same page. For us, it's all about networking, so we're big on advocacy. And of course, for today, our key area is advocating on how we can rethink and eradicate TB by 2030. So please use your electronic hand, but if you cannot wait to the Q&A section, please do type your question using either the chat option or the Q&A option, and we'll be looking into that and just call you out later on for you to ask it directly, or we'll read it out. But always be on mute in case you're unmuted, but do rename your account because we'd also want to know who is attending this particular call. So please also use the chat. Let us know who you are, where you've logged in from, and some of the work you're doing, because we're always looking for collaborative areas on how we can further the discussions on how to eradicate TB. You've subscribed to the webinars. Of course, it's one of the many series we have, and that means you've already given your consent to the webinar being recorded. And of course, we want candid discussions. We're going through a rough patch with a TB funding freeze. We've seen this impact a lot of programs. And most of us on this calls have been directly or indirectly impacted by the US directives and the stop work order. So we do respect everybody's opinion and we want to hear from everybody. So just network, let us know who you are, let us know how you think rethinking the strategies that we have will help us eradicate TB by 2030. Next slide, please. There's a lot of progress that has been made in the fight against TB. And with the funding cut, we've seen there's a lot of actually negative impacts that have directly come out. So these are just a few of the the headlines that have been, a little bit shocking, to be honest, on what that funding freeze and that funding cut actually could do. And we're seeing also tuberculosis, not only something that affects the African continent, but we're seeing cases of TB rising in the UK and the US. So this is a global concern. And the cut is affecting us as a continent and globally. It's not only an African issue. Now, funding cuts have jeopardized global fight against tuberculosis. As I mentioned, on this call, we're either directly or indirectly affected by what has happened with funding costs. But this is why we have this kind of advocacy and deliberations. How can we rethink? How can we recommit, redeliver, and reinvest? That's the discussion we're going to have today. These are just some of the few headlights that have made out the news, which has been quite alarming. Next slide, please. But all is not lost. I mean, we found ourselves in a rough patch, but that doesn't mean we drop the ball. That doesn't mean we stop the fight. So what we're going to do is we're going to push on. And of course, one of the discussions we've had in a couple of weeks ago is how does domestic health funding actually cover all of this? And this is good because I'm seeing a lot of countries trying to look at how can we internally fill these financial gaps. And of course, African region records further decline in TB cases. It's what we want to see every time we open up a newsletter, a news article, any report. We're just hoping that this will be the cycle. This is how it's going to keep on. And of course, for South Africa, they aim to test 5 million people annually for TB to reduce infections. And that's a big number. And if every country can actually do this, we'll be taking a broader step in eradicating this disease. So ladies and gentlemen, next slide. Before I kick off the discussion, of course, we have experts who know what TB recommitment, rethinking, reinvesting, redelivering actually means. I'm not an expert, but I'm very curious on how they think we're going to re-strategize. Of course, we're talking about eradicating TB by 2030. We have the NTB strategy, which is also by 2030. We have the United Nations high-level meeting on TB that took place last year. So we have a lot of commitments, but then where are we going to get this investment from? We now need to rethink. How do we recommit, redeliver, and rethink? Next slide, please. So without further ado, as I've been emphasizing, the theme is the World TB Day theme, which was, yes, we can end TB, commit, deliver, invest. But for us, we want to figure out how can we have all this conversation. Let's rethink committing, let's rethink investing, and let's rethink how to deliver TB services and commodities. Without further ado, of course, the faces that are being projected, we're hoping that the Honorable Stephen Muller will join us later on. I'm not too sure, but I'm sure my team will give me a heads up once he joins. But of course, Chief, you're here. I already said hello to you. And you're a familiar face when it comes to, stopping TB, advocacy around TB. Everybody, I'm pretty sure on this call has bumped into Chief Austin Arinze Obiafuna, who is the founder and the executive director of Afro Global Alliance Ghana. He's also the vice chair of the Stop TB Partnerships Geneva, and I think that's one of the titles that everybody would actually relate to, and the former national coordinator of Stop TB Partnerships Ghana. Now, he's going to give us his opening remarks, and we're hoping that, it will kick off these discussions as we rethink everything TB. Chief, if you're there, please take over. And we can just stop presenting for a minute so that we can see his face also.
Thank you, Lizzie. I hope you can hear me.
Yes, and I can see you. Welcome.
Thank you very much. And that was a wonderful introduction of the whole webinar. And thanks for leading that. I want to say morning, good afternoon, and good evening, wherever you're joining from. I know that people are joining from different parts of the world. And kudos to everyone who joined to make this World TB Day here, very, very memorable, because I really enjoyed myself. I saw a lot of activities floating around the social media, and all social media platforms were flooded with World TB Day messages. And I must say, I'm also happy that we are having this post World TB Day program, because I'm one of those people who always say that it's after the World TB Day, we do not have any other communication, awareness happening again. Everything goes quiet. But it's good that we sustain, such campaign whenever it happens. So let me say thank you to INASO, ACT Africa, developing country NGO of the Stop TB Partnership, for organizing this webinar. Is very, I must say that it's quite timely and very, very important, at least most especially with this kind of political atmosphere that we have now. We know what is happening with TB. We know what is happening with the US funding freeze, and it's really affecting everybody. And that's why ACT is also taking lead in trying to conduct some kind of poll just to understand the impact of this funding freeze on so many organizations and partners that we work with. So on that note, I want to say that this is very important, and the discussion that we're going to have today is going to also, lead us into understanding that advocacy is not an event of a day. It is a process. It's something that has to be continued. It's not something that once you just have the World TB Day, you have your speeches, nice speeches, and they carry a placards in case if you had an outdoor event, and that's all. No, we need to sustain that message. I was in Nigeria during the World TB Day. Where else would I have been? This was a wonderful event. The First Lady of Nigeria, Her Excellency, Senator Oluremi Tinubu, she is a real champion. We named her a global and a national TB champion, but I must say that she's a real champion. In my life, I have not seen some people who have such kind of enthusiasm and support, and people who match their words with actions. So she donated initially when we had, in just less than a year, she donated 1 billion Nigeria naira for TB response in Nigeria, as if she knew that we're going to be facing some kind of real challenges from funding, and also trying to increase domestic funding. And again, just 2 days back, she donated another 1 billion naira. So I'm saying this because domestic fund, resources is very important, is very key. If you want to really be more accountable to, to the cost of TB response around, in your country, within your corners, even at your lowest periphery. Domestic funding is very key. And I must say that the civil society has been, in forefront when it comes to domestic funding, because out-of-pocket expense, because of our passion for the work that we do. But we are beginning to see change, not just because of the US freeze, but for people who understand, why we should fund the TB response, in countries as well, and also for the domestic resources. So I must say I was very pleased with the whole activity, and I would want to see more of that at least in our own continent happening, so that we can be proud to say that our countries are pushing. African Union also made the same statement for Africa, for the countries to be able to stand up and fill in that gap. So on that note, I want to say thank you to the panelists who are about to speak, to say that we will be listening in the background. I know that you're going to give us a lot of insight in how we can be able to sustain some of this commission, and also highlights a lot of what happened around the world, especially in our African continent. So on that note, let me say thank you to NASA, thank you to Lizzie, thank you to ACT for inviting me to have this opening remark. And thank you to, I don't know whether, I haven't seen Honorable Muller, but
Yeah.
I think we'll also be here to welcome him. Thank you very much.
Thank you very much. We appreciate it, Chief. I mean, and you've you've just opened up the whole discussion, because you've touched on the fact that this is advocacy. It's a process. It takes time. We'll get there, but we really cannot start, losing hope right now. But it's also good to see that First Ladies are taking such kind of an initiative, and they are literally showing us that domestic financing is something that actually we can look into, and it can actually work and fill that gap. So thank you very much, Chief, for that. Ladies and gentlemen, that was Chief Austin. He just delivered the welcome address and remarks. I know we're supposed to have a keynote address, and we're hoping that Honorable Stephen Mooley will actually join us, and once he does, of course, we'll recognize him. But to kick us off and just start this discussions, as I mentioned, this is a post Whilst TB webinar, of course, we're looking at the three aspects of this year's theme. How do we recommit to redeliver and reinvest? And we talk about reinvesting in TB. And of course, we have Bertrand. I hope I've pronounced that. Please go to the next slide. Yes, so Bertrand is a public health expert. And of course, all these faces that we're going to actually, show and the names we're going to mention, these are people who are well known within the TB space. I mean, they're vocal advocates in eradication of TB and other public health diseases. So with Bertrand, which I'm so sorry, I know I'm still butchering your name, is a public health expert with a special focus on health and community system strengthening, gender and human rights. And he has dozens of years of experience in planning, management. You know how monitoring and evaluation at times can be a headache, but he's actually a guru when it comes to that. So he has carried out more than 15 technical assistance missions. We appreciate how TAs also go quite a long way in ensuring that our advocacy efforts and implementation of programs kind of goes through. Bertrand, if you're there, I know you're there. I'm not going to say if you're there, but I know you're already on this call, and we'd want you to let us know, how do we reinvest? We're just looking at addressing the funding gaps. We know, and our Chief Austin has mentioned, we do have funding gaps. Now, how do we reinvest and look at this? Bertrand, over to you.
Yes, thank you, Lizzie, for the amazing presentation. Happy to be here. Hi to everyone.
Happy to have you. Welcome.
Thank you. Today, we would like to discuss about the funding we have of the TB. I'm presenting on behalf of Draft TB. Draft TB is a regional umbrella network organization in Western Central Africa, bringing together 16 countries with more than 300 organizations who are involved. Next, please. So my presentation will have three specific components and global overview of where we are in terms of the NTB strategy milestone. After we are going to discussing some TB funding gap in Africa with some example from 4 countries in 4 different regions of the Africa. And then a specific case study from Cameroon. I'm happy to present to you this picture where the key message is that we should keep the line on. Next, please. So are we on the tracks? This picture from the Global Fund keep us in mind that so far we are not on the track. Because clear targets was set up for 2030 on the NTB strategy goals. But even since 2025, progress has been made in terms of reducing the TB death. The progress is very, very slow. And then on the other area, you can see the TB incidence. TB incidence is also very, very slow. So there are also a lot of effort to be made to make sure that we keep being on track to achieve the 2030 goal. Next. And in 2022, WHO emphasizes that the Africa region will request at least 1.3 billion annually for TB prevention, treatment, care, and support, community engagement. So there is a need for around 1.3 billion. But they continue to contribute only 22% of this amount, with more than 34% coming from external sources. On those external sources, we can quote, for example, the Global Fund or even Stop TB Partnership through the Challenge Facility for Civil Society. So the remaining budget shortfall severely hampered the effort to eradicate TB. With the funding we have now, we are not really on track to have those 1.3 billion annually for TB prevention and treatment. And next, we have some example from 4 countries in Africa from 4 different regions. So we can see on those slides that national contribution in terms of domestic funding from TB, there are some of disparity from those countries who can contribute 20%, for example, in Ivory Coast, you see that international contribution, for example, last year, it was 2023. Last year, the country was in need of 9.3 million US, but lot of funding, even only 20% of those funding, around 20%, 1.7 billion, 1.7 million come from domestic funding. And all was from international funding. This is West Africa. If you come in Central Africa, you have, for example, contribution, the picture from Cameroon, where the target for 2023 was 8.8 million. And then the domestic contribution was around 25%, 2.4 million. This is from West and Central Africa, and you can see some change. You have, for example, in South Africa. In South Africa, the goals, the expectation for 2024 was 75.5 million. And domestically, they contribute, from the domestic funding, they contribute for 51 million. So it's around more than 70%. So the contribution, if you compare the contribution from those countries in West and Central Africa and those countries from South Africa, for example, you realize that domestic contribution is much higher from those countries from West and Central Africa. On the blue is the domestic contribution, and on yellow you can see is international funding. But that the very good example comes from the North Africa in Tunisia, where domestic funding was 100% from the national contribution. So in Tunisia, for example, they succeed to fund all their need without any single contribution from international partners. That is not, it's not meaning that they have a lot of money, but it's something like, in terms of the political will. The political will, well, the country and the leader at country level, they have the political will, they can really have 100% in terms of the national contribution. This is data from WHO 2024 report. So the lesson here is that it's possible, it is possible to have a country who can fund in 100% the TB response from domestic funding. And we have examples, so that the conclusion here is that maybe we need more advocacy to push for domestic funding in those countries in the West Africa and also Central Africa, where domestic contribution is very low, and there is more effort if we need to reach the target from 2030. Next, please. And here we have an example from Cameroon. Next, we have a specific, Lizzie, next. We have a specific example from Cameroon where we implement a Stop TB Cameroon. Next, please. We have that case study Cameroon, where we launched a national TB financing campaign. The TB financing campaign brings together all organizations who are part of the Stop TB Cameroon. Is more than 60 organizations in the 10 regions, who since 2022, with the support from Lizzie. Next, please. Okay, thank you. So this is the case study from Cameroon. The campaign was Fund My TB Response, and it was a campaign bringing together all the organizations in the 10 region who are part of Stop TB Cameroon. So we create, the campaign was on two specific areas. Area next, one area engaging with parliamentarians, and one area engaging the private sector and civil society. The area of engaging parliamentarian was working together with the National TB Caucus, where together with the lead of the honorarium chair of Stop TB Cameroon. So we contribute to relaunch a national caucus, and then they will succeed to make some intervention during the parliamentarian session, providing some update information. The parliamentarian also engage with some advocacy video. So we have more than 10 video with parliamentarian where they bring their voice. The previous one, please, when they bring their voice. And also, we also have that engagement with the private sector, where the private sector, we had a specific TB finance working group. We did a Stop TB Partnership Cameroon. And then we bring together some private sector company, and we also have rich engagement of TB survivor on the campaign. And the last PowerPoint is that we are still working to make sure that we keep the light on. And our goal is to make sure that we can increase the domestic funding contribution from Cameroon to make sure that we can meet the NTB goal. Thank you.
Thank you very much, Bertrand. And I like the fact that you've even brought in the aspect that Tunisia actually did this already. I know we're trying to think about how domestic healthcare financing can work, but they have been doing it. So that's a south to south learning that really I feel like ENASO should actually get Tunisia on a call just for them to let us know how they're doing it and what we need to. For now, we really need to copy paste what's working. What's not, we keep it to the side. But thank you very much, Bertrand. Do stay, because I know Evelyn Kibuchi is here. Evelyn, are you here?
Yes, I'm here.
Oh, perfect. I was getting worried. Okay, so Evelyn, I was going to read your bio, but unfortunately, it's not being projected. So just give me 1 minute. I go back to my PowerPoint slide. No, oh, thank you. Thank you. Ladies and gentlemen, everybody who is within the TB space and knows how vocal advocates can be. You've already bumped into Evelyn Kibuchi, who is a global health advocate with over 15 years in TB advocacy. That's why I don't even have to read her CV. She's currently the National Chief Coordinator of Stop TB Partnership Kenya and a member of the Civil Society Task Force at the WHO organization, TBT. Now you can see she has tentacles from the national level to high level advocacy. So thank you very much, Evelyn, for joining us today. I know we're looking at how we can reinvest, right? It's the theme, but we're in a place where we need to re-strategize and rethink. So over to you. You do have 7 minutes. And thank you very much, Bernard, for that. You just kind of gave us a leeway to get Evelyn to pick up the discussion. So Evelyn, over to you.
Thank you so much, Liz. And before I move on, I want to update my profile just here on this platform. It's now 17 years. Yes, in TB advocacy.
Okay.
And for the Civil Society Task Force, I'm formally, right now I'm in the WHO Civil Society Commission Communications team.
Oh,
okay.
This is amazing. This is still a big kudos to all that improvement, and we'll definitely update this. So over to you, Eve. And congratulations.
Okay. Thank you. And of course, still coordinating the Global African Parliamentary TB Caucus activities. Anyway, let me jump into the conversation. Yeah, the previous World TB Day, 24th of March, marks my 17th World TB Day that I have celebrated. That tells you, for real, I've been around for such a long time. And when the day came, I went back to my history and my archives. And I came across this newspaper publication that I did on World TB Day of 2007. And you'll allow me to read just 2 sections of it. The opening statement was, the government should declare TB as a national emergency. Of course, I was referring to Kenya. Allocate more resources to treatment and fund research and development to stop the disease's deadly spread, right? To eliminate a disease that by then was killing 70 people daily in Kenya. Okay. Allow me to go to just another quote. This is 2007, okay? I hope you get note of that. It said, it's obvious that to allocate more people, to locate as many people with TB, we need to increase aggressive communities to engage in community approaches including creating awareness, creating knowledge and awareness, in addition to advocacy for access to health and services, and as well as addressing stigma. Okay, that's 17 years ago. And 17 years later, we are still using the same language. More funding, more community engagements. And I kept asking myself, what are we not doing right? Why should we be talking about the same thing for 17 years? And I thought we need now to also reinvent ourselves as communities, even as we reinvest in TB. And I came up with a few recommendations from my many years of TB advocacy on how communities can now reinvent so that we can reinvest in TB. And I will take it in two perspectives. One is to think about what should stakeholders do more in engaging communities so that we are able to change the scene. And the second bit is, as communities, what do we need to do differently? So first of all, the stop to work order came as a wake-up call to all of us. For the longest time, we've been telling our governments domestic resource mobilization, like it has become, like a rallying call. But it sort of fell on deaf ears. That's why it caught us flat-footed as stakeholders in TB. So what do we need to do? We would ask the stakeholders to more involvement in all the processes. So all the processes, the process of policy making processes, decision making, I know we have been asking for that. I know we've been given the platforms, but they can still do much more. Okay, to ensure that there's 100% of involvement of communities in all the processes, that we are key stakeholders, that we're not being called as a second thought, that we are there at the table from the beginning as main stakeholders. Secondly, we need to be acknowledged. Our role in advocacy, our role in community activities. Communities make such a huge difference in TB response at the community level. I keep saying, remove communities just for a day and let the TB program run, and let's see the gap that will be left. Imagine with no one addressing stigma, with no one creating awareness, no one doing case finding, all the work that communities do. Imagine for a day without them. Okay. Secondly, so communities need to be acknowledged that we play a very significant role, and our contribution must be quantified for whatever it is. At the country level, this is our quantify contributions of communities, so that we can also use it as a bargaining point in resource mobilization for communities. Number 3, and this is one challenge that we came across in the stop to work order: access to data. Even now, we are still struggling, and I'm sure this is happening in different countries. Accessing data, for example, what is a gap that was left by the stop to work order by the US in terms of funds at the country level? So that when you're going to our governments and telling them step in, then we are talking in terms of figures. We want you to step in with XYZ dollars. We are still trying to access that data, much as these stakeholders know our role as advocates, but accessing that data to assist us in advocacy has been such a big problem. Of course, communities come with strength that nobody else has, providing the personal, the lived experiences that make all the difference. And that has to be strengthened. Support communities to share their stories, share their experiences, and also bring to public the experiences of others who would not have that platform. So Without those experiences, which are brought by communities, then we don't have any evidence for advocacy. Okay. So that is pretty much what I would tell the stakeholders. But now, as communities, what should we do? We need to reach out. If we don't aggressively reach out, looking for data, saying, claiming our space, then it will never be given to us. So we need to aggressively reach out and ask for our spaces, demand for our spaces in the TB response and in the decision-making processes. We should also demand for our positions to be acknowledged, like I mentioned before. I know we were badly hit because most of the resources that were supporting communities was one of the components that was affected. And much as we're still doing advocacy for the resumption, I'm thinking we need to look for other doors for more resources. And where can we look? Of course, we've been talking about the private sector for the longest time. But how about the governments themselves setting aside a budget line for supporting communities for the work we do? Why do we always have to leave the role of communities to be supported by donors? How about the Ministry of Health, when they are doing the budget for community support, because we play a very significant role? I feel that's an alternative window that we have not looked into. And for the private sector, we cannot leave that behind. And just give an example. In Kenya, we have a team of communities that approached a company that makes flour, flour for cooking. And they said, our patients are affected by malnutrition and with the stop to work order, and it's affecting access to nutrition. And guess what? The company stepped in. So they stepped in and they actually gave the flour and they branded the World TB Day t-shirts, with their logos. And I thought that was a very good approach to looking for alternatives of funding for what we do. And we also need to equip ourselves with all the information, all the data that is required for advocacy. For example, knowing the frameworks within which we are working with for TB response and also for funding. For example, the Abuja Declaration, knowing which countries have achieved the Abuja, if there's any, and which ones have not, and the levels where we are at a country level. So you can use that as a bargaining point when you're doing advocacy. The African Leadership Meeting and the commitments the countries have made, the United Nations high-level meeting, both of them, what are the commitments, so that we use that for advocacy. And finally, where our individual countries are at, where are we at, what are the gaps, again, and develop what I would call investment cases for civil society that we can use for advocacy. And finally, just a persistence, consistency in the messages that we want to pass across. I will stop there. Maybe I'll take questions.
Thank you very much.
Thank you.
And thank you for just highlighting and bringing what we know pretty well. Communities are playing a crucial role. It's time for us to actually quantify that and maybe tell them this X amount should be matched by this X amount from the government. But thank you very much, Evelyn, for bringing all those crucial points. And I totally agree with you. Ladies and gentlemen, if you've just joined, this is a post-TB webinar, and we're looking at, of course, yes, we can end TB, but how do we recommit, redeliver, and reinvest? And we started off the panel quite well by looking at how we can reinvest. And of course, Batnan took us through the funding gaps, and Kibuchi has also picked that up and also run in and brought in the aspect of community involvement. What is the crucial role that we play? But thank you for re-emphasizing that we need to reinvent before we start thinking of how to reinvest. I really like that particular quote. So thank you very much, Evelyn, for that. And thank you, Batnan, for your presentation. So we're moving to the second beat of the discussions. And I know we have Mayowa already here, and we're looking at how to redeliver TB innovations. And I know Evelyn has also touched on coming up with innovative ways of resource mobilization, but how do we redeliver TB innovations? Mayowa Joel, if you're on the call, I know I saw you for a brief meeting while we were doing that whole speaking, just making sure your camera is on and stuff. But to give you a brief on who Joel is, he's a development specialist and the board member representing developing country NGOs on the executive board of Stop TB Partnership Global, based in Geneva. So Mayowa is also the executive secretary of Stop TB Partnership Nigeria, a multi-stakeholder partnership working to end TB in Nigeria. And as I mentioned, these are the experts. I don't know much about TB, but what I know is we really need to reinvest, recommit, and redeliver. So Mayowa, if you're on the call, please just have your microphone unmuted.
Okay.
And
Thank you, Lizzie.
yes. Perfect.
Thank you
Over to
very much. Good afternoon, everyone. And special thanks to the organizers of this webinar, NASO, ACT, and others. My sincere apologies, I won't be able to put on the video, but I hope
No
you
worries.
can hear me.
And Mayowa, just 1 minute. Maybe Linda and the team, if you can check, I think the chat function is not working for the rest of the team, but thank you. Sorry, Joel, over to you.
Okay. Thank you. All right. So my topic is investing in TB financing and vaccine development. Next slide, please. The question is, or just to provide some brief of background, TB is still a disease of the poor. And more than 19% of TB cases still occur in developing and social emerging countries. 10.6 billion people had TB cases in 2021, and we had 1.6 million people died of TB in 2021. And we also had over 25% of people all over the world, about 1/4, still had TB. So TB is still a big epidemic, and the mortality rate surpasses that of HIV and malaria combined. The challenge is, with disease of this magnitude, it cannot be ended or eliminated only with drugs and pills, specifically when we talk about injection and pills. I've never seen a communicable disease, being eliminated only by true treatment. A robust prevention is necessary, and that prevention includes the use of vaccine. So the question is, why do we need TB vaccine or a new TB vaccine? Next slide, please. We need TB vaccine because the current BCG has limitations. It does not adequately protect adolescents and adults. And these are those who are responsible for the large portion of TB transmission. We need the new TB vaccine that targets adolescents and adults if we are going to be able to reduce TB incidence by 80% and death by 90% by 2030, as stated in the WHO TB strategy. A new vaccine is needed to prevent TB infection reactivation and transmission of drug-resistant strains. Also, a new TB vaccine has the potential to reduce TB incidence, prevent the progression from latent TB infection to active disease, and curb the transmission of drug-resistant strains, making it a critical component of TB control strategies. So, what is the latest update on TB research and development financing? TB research and development has been chronically underfunded in relation to the impact of TB upon global health. I have stated earlier that TB deaths causes more is more than that of HIV and malaria combined. At the first ever United Nations high-level meeting on TB in 2018, world leaders pledged to devote at least $2 billion per year for TB research, of which 550 million was earmarked for TB vaccine research and development. But here is where the action differs from the talk. So despite these commitments, TB research is impeded by annual 1.1 billion shortfall, while funding for TB vaccines has never exceeded 120 million. Imagine, out of 550 million per year, we only have 120 million. So this has greatly hindered the development of new and desperately needed TB vaccines. The global plan to end TB from 2023 to 2035 projects that an annual investment of 1.25 billion will be needed for TB vaccines research and development. If we are to have a vaccine of reaching, to have a chance of reaching the NTB targets, which is to decrease TB mortality by 90% and decreasing new cases of TB by 80% 2030 as compared to 2015 rates of TB deaths and disease. If you look at the diagram on the right side of the slide, it shows that we have overall TB vaccines in the pipeline 11, and those that are the late efficacy trials are 9 of them. To be able to ensure that we'll be able to conclude on these trials and have at least a widely acceptable TB vaccines, then we need to have adequate resources to be able to finance it. Now, next slide. Advocacy for investment in TB research and development. World leaders, first and foremost, need to fulfill their commitments to end TB by 2030 by investing their fair share to support a fully funded and resourced TB vaccine pipeline so that new TB vaccines are available as early as 2028. You did the talk. Now it is time for them to do the action. And this will not be possible if we don't remind them. I tell you, like Evelyn mentioned, we still make mention or refer to the Abuja Declaration of 2025. Up to now, many of our leaders or governments have not been able to meet up to that expectation. I can tell you some of the leaders who are the 2018 UN high-level meeting on TB, they have forgotten that they made this commitment. So our advocacy efforts should be targeted at reminding them that you made this commitment and now it's time to deliver. The cost of inaction widely surpasses the cost of action. TB vaccines are predicted to be highly cost-effective in nearly all high TB burden countries and cost-saving for a societal perspective. Overall, TB vaccines is cost-saving than the treatment because the many lives that will be, many people will be prevented from having TB. So they wouldn't have to go through both the social, economic, and psychological challenges that a TB patient will go through. And some of this cost comes with a very high cost. Okay, and so that's why our advocacy for investment in TB research and development is important. We also note that for every $1 invested in the delivery of a new TB vaccine, that is at least 50% effective in preventing disease among adolescents and adults, it will return $7 to the global economy over 25 years. In the same period, up to 8.5 million lives can be saved and up to 76 million cases of TB disease prevented, averting up to 42 million costs of treatment and reducing the pressure of the global anti-microbicide crisis. If we have a TB vaccine that is at least 50% effective, just 50%, we can achieve a lot. And history has told us that this is possible. If you look at the case of COVID, and very short time it took the global partners to be able to come up with COVID vaccine. This tells us that to have a vaccine for TB is possible, and it's possible for us to deliver on or before the target year of 2028. And the global market for new TB vaccine is huge, with demand forecast of over 5 billion doses for adolescents and adults. So this is what is at stake. Number one, we need to advocate more to the government, first to developed countries and pharmaceuticals, to be able to invest more in TB vaccines so that we can have these TB vaccines available as early as possible. That is one. Number two, we need to also advocate more to our government, especially implementing countries, to provide more support to provide more domestic resources to support TB program. I tell you, very few, I'm not sure there are many implementing countries that are providing direct support to TB research and development. There are not many, if there are at all. But even if they are not, if they can support their own TB programs and services, support programs for epidemic preparedness, support programs for vaccine introduction, then it will help the donor countries and developed countries to be able to focus more of their own resources on vaccine development. And lastly, let me state that the private sector, like my colleague Evelyn has said, has a lot of work to do. If we have a global market of this magnitude, we can, we need to really advocate more to the private sector, especially the pharmaceutical companies. They have not invested enough in developing TB vaccines because, like I said in the first slide, TB is more or less associated as a disease of the poor. And so many of them are waiting for grants and support from governments to be able to, start or support the process of developing vaccines for TB. But if they see the market, and because these guys are more interested in the profit they're going to make, if they see the market and the profit they're going to make overall, then maybe they will reconsider. Let me end by saying that, again, restate the fact that we cannot end TB without a vaccine. It's not possible. And that's why our advocacy for investment in TB vaccine is important. And that's the more reason that the Developing Country NGO delegation of Stop TB Partnership has taken the need for TB vaccine as one of these priority or advocacy priority. On that note, thank you very much.
Thank you, Joel. I honestly do not know what to say after that because it's very true. When we're advocating, we need to have a vaccine. We need to start from somewhere. And of course, we see how, with your presentation, what I like is the numbers. The return on investment was clearly shown there. If you invest in this, your ROI is going to be X amount. So this is really something that, if they do not understand how these numbers work, then you really do have a problem. But ladies and gentlemen, we're talking about rethinking the whole Stop TB agenda. How do we recommit, reinvest, and redeliver if we are to, yes, agree that we can stop TB by 2030? Looks like we need to figure out how we can, as Evelyn just said, how do we reinvent before we start asking to reinvest? And I know Chief also brought in the aspect of advocacy, and you've had Joel also pushing in on how much advocacy really means. We need to advocate. We need to make our voices heard. And I like the fact that the attendees are also introducing themselves. I've seen community health workers and promoters on the call. I've seen advocates. I've seen, development communication people, etc. So feel free to actually introduce yourself. For us as YENASO and the partners who have hosted this call, so that's ACT Africa, TTCN, Tanzania, you name it. For us, advocacy is key. So how can we bring all our forces together? and push, because clearly we need the money. It's all comes down to the financing. But how do we get that financing now that we have a funding gap? Ladies and gentlemen, we just started by looking at reinvesting, and now we've skipped to redelivering vaccines. But we also want to see Stop TB's perspective. Where are we? We've been dealt a blow. We're recovering, but we're all on the same page. We're not going to give up the fight in eradicating TB. Not yet. We're not done yet. That was a blow, yes. But the way we normally say, you know, we have our shock absorbers. We're getting back on our feet, but we're rethinking everything. Now I'm going to call upon James Mala. And I know everybody knows James. The good thing is you guys make my work so easy. You're so vocal within the TB space. But the minute I mention your names, everybody understands who I'm talking about. So James is the Community Engagement, Capacity Building, and Stigma Reduction Coordinator at Stop TB Partnerships, UNOPS. And of course, James, everybody has been waiting. What is your perspective? How are we going to re-strategize? I mean, we have the UNHLM meeting on TB. We have the Stop TB strategy by 2030. I mean, we're running out of time, but we've just been dealt a blow right now. So how do we re-strategize? What is the perspective of Stop TB? Over to you, James. Welcome.
Thanks so much, Lizzie, and thanks to the speakers as well who have already shared some views. I think there's a lot of really good ideas, a lot of good ideas there. Some of which I might just like touch on again as well, if that's all right. I guess as is clearly, I guess, the parameters for this discussion, you know, there is a need for us to shift our thinking, our actions around TB financing. Clearly, the approach that we've undertaken to this point is not going to be the one that we sort of undertake going forward. But it's also, I think, you know, critical to remember that TB was chronically underfunded for many years. You know, so whilst we do face significant challenges now with different changes in priorities in many countries, there is and has been this need to address TB financing for a much longer period. And this is an important starting point. It is something where this creativity is required. And maybe at this moment in time, you know, collectively, we need to come up with some innovative approaches to really take forward. Now, some of the things that I think, you know, as you mentioned, some of the speakers before have already mentioned, there's some strengths here to really draw upon, you know, and Maya, your discussions on the vaccine are very much to the heart of that. Like, but even more, you know, fundamentally, the return on investment is, as was also said, it's over 40 to 1, you know, across the board, and it's even more than that in TB high burden settings. So this is a really good investment for government. So if we sort of, you know, take a step back from the space in which we commonly work about why investing in TB, in TB HIV, in TB PPPR, in health systems is important. It's something where we can make our case to a broader range of stakeholders in a more effective way. And certainly the idea of return on investment is something that is compelling to many partners. Not only that, but the investment is in something which is already, even before this idea of a new vaccine, it's already something that's largely preventable, largely treatable, largely curable. You know, so this investment is something that saves lives. We do have some solutions. Now, the other thing that I think is important here that I wanted to touch a little bit more on is that we're also at a really unique moment in time of opportunity. And Liz, you mentioned about the UN, the political declaration. We have a level of political commitment that maybe we haven't had before. So this is, again, another really strong positive to make a compelling case for investment in TB. Even more than that, and linked to this discussion, I guess, building on some of this idea of innovation, we have new tools. We have tools now that we didn't have just a few years ago. We have tools that we can transport with relative ease to ensure that people can access these tools no matter where they live. We have things that are smaller, lighter, more accurate, more effective, cheaper, shorter. We also have the things like, as Maya said, we have a vaccine on the horizon. We have the increased use of AI for computer-generated diagnostics and beyond. So we have a really exciting moment in time where we have an opportunity to really end this epidemic. And further to that, you know, just a few months ago when we had a Stop TB Partnership board meeting in Abuja, collectively TB stakeholders recognized, reflected, and celebrated on the significant progress that countries have been making in recent years. So this is all, I think, just to say that whilst we do have so much uncertainty, and without a doubt there will be significant implications on the ground as we address to this new reality and we adjust to this new reality, we have a lot to build upon, you know, and I think that that's something that is an important thing that we collectively understand and we take forward as a central sort of message. The next thing that I wanted to just talk a little bit to is just why when we talk about funding and investments in TB, we also put front and center the investments in TB communities. TB affected community, TB civil society, local community organizations, networks. The role that is played by these groups, first, cannot be necessarily played by anyone else. So that there's a critical role here in TB, in pandemic preparedness, in health systems, whereby we need to invest in communities to fill this gap. And secondly, it directly links to saving lives, a lot of this work. So this is something that's really critically important, again, for us to be thinking about in terms of how we have this discussion on funding. TB-affected communities and civil society, they can reach the hardest to reach populations. They can ensure that they can screen and ensure that people get taken for testing, get diagnosed, commence treatment, complete treatment faster. This ultimately breaks a chain of transmission for TB. When we're talking about ending TB, this is the process. It's doing that effectively, doing that quickly. And TB-affected communities and civil society play a really critical role in this space. They also are able to identify and mitigate some of the barriers that people face in trying to access these services. Again, they have a unique perspective and a unique position. And this is, again, pertinent for any discussion around funding. As well as this, and I guess building off Mayo's discussions around a vaccine, but taking it slightly more broadly, communities are uniquely placed to drive demand creation, to make sure that there's investments in a TB response, investments in new tools, investments to create partnerships with private sector providers and innovators. This is all things that go directly to overcoming barriers and ensuring people can access those services that they need. By doing this, you're contributing to saving lives. And I think that this framing is something that is critically important. And I guess just to conclude this particular point, while we do this, by investing in communities, affected communities, and local community organization networks, civil society more broadly, you're building this community system. And this is a community system that will still be there, just as it has been over these past more recent times of difficulty, in spite of political changes, whether they be domestic, whether they be international, whether they be something else. And so for sustainability and a long-term effective solution, investments and funding for TB communities is something that's critical. So this is something, I guess, for those two areas for context. And then I guess the third area I just wanted to speak to quickly, Lizzie, if that's okay, is just about, I guess, when we're talking about funding, what it is that some of our priorities, at least in the short term. And I caveat this by saying I don't have a lot of solutions here. Many people on this call know much more than me around these areas. But they're things that I think are important to put into the mix. Now, the first is that we need a really strong global fund replenishment. Now, the Global Fund plays such an instrumental role in the TB response. In saying this, the changes that we've seen very recently have really emphasized the challenge of funding in TB. And the Global Fund currently gives 18 cents in the dollar to the TB response. This does make a difference. It does save lives. We all need to mobilize behind this response. But at the same time, we also need to look for opportunities to increase how TB funding opportunities, whether through Global Fund directly, whether through Global Fund countries who are donors, who have set-asides, and them allocating money to TB responses as part of their Global Fund contribution. And for example, there are countries now, donor countries, who allocate and earmark money as their set-aside that go to things like TB Reach, to Challenge Facility for Civil Society, as part of that Global Fund commitment. So this is something which I guess as TB partners, we need to be thinking about What are our asks for donor countries? Obviously, we want a fully funded global fund, but we also want to ensure that as part of that, we're getting full funding to these mechanisms that play critical roles in the TB response. Second, we also need to just start to bring in some new donors at a country level, recognizing that it's not just the US, which has had a shift recently, but several other countries, including in Europe as well, have reduced. But we need to find ways that strategically secure some investments, whether on TB specifically, on TB and PPR, on health security, finding the smart line, which also strengthens TB responses, but also strengthens the communities, the people who live and work in, and the broader and the health systems of the countries, because ultimately that's a key goal here. A third thing I think is looking at these private sector partnerships, and again in the previous presentation there was discussions on this in the specific context of a vaccine, but it's also about what this financing looks like. What are opportunities for when we can engage with private sector to do this? And sometimes we think of private sector just as pharma, but it needs to be thought of as much more broad than this, whether it be private sector providers, whether it be innovators, whether it be private sector who are into philanthropy as well and might be willing to directly contribute and engage that way. Now, one of the key things here, though, and I think we've all know this and have spoken to this, is that domestic financing has a critical role to play. Now, some of the countries which have maybe had lower levels of impact from recent changes in donor funding have been those which already had significant national commitments in health and specifically in TB. And there's a number of countries that can do that. And we did hear a lot about that, in recent times, and I know many of the countries in the region play that role. But there's also been an opportunity to improve towards some of the higher level commitments. What percentage of our national budgets are going to health? What percentage of our national budgets are going to TB, and how can we do that? Obviously, in recent weeks, we've seen many leaders in the region come out and say, and make agreements, commitments, and actions, which have done exactly this. But this is something that we need to maintain, and we also need to ensure that TB is a part of some of the gaps that are getting filled, and that TB communities, TB civil society, and the important role that they play are also not left behind here. So the final point, I guess, I just wanted to note and to conclude on is very much noting that a lot of the partners who are leading this call have been instrumental in terms of building community movements through Challenge Facility for Civil Society. And so I think it's critically important to sort of note that this is a mechanism that we should also be putting front and center in our advocacy, really sort of noting that whether we're talking about funding demand creation for vaccines or other new tools, whether we're talking about political engagement for ensuring increases in domestic funding for health across the board, efforts about identifying and mitigating barriers to access so all people can be treated for TB, whether it's about the additional, incidental services like nutritional support, mental health support. Again, it's communities and civil society that uniquely can play this role, facilitate this role, and ensure that this can work well. So we must ensure, I guess, that like the advocacy that we're doing reminds everyone that this isn't just an add-on of something nice, but it directly strengthens TB responses. It directly contributes to saving lives. And so I think that that's something that, we all obviously have a shared piece of work ahead of us to not only frame this the arguments and make a compelling case for investments in TB to fill the gap, to adapt to this changing landscape, but to ensure that those, the communities in which we all serve are supported. The communities that we all serve have access to the prevention, the diagnosis, the treatment, the care, and the support services they need. So I might leave it at that, Lizzie, and thanks from the side of Stop TB for the opportunity to join today, and just applauding the efforts of all of the partners to host such a timely discussion. Thank you.
Thank you, James. And I like the fact that you brought in the ideas we're literally looking at. We cannot drop the ball. And the way I was reiterating, we've been shocked, but it's not a time to, push back. We have to push forward. And we've seen the crucial role of CSOs, communities, and we're going to pull this through. We just need to rethink, re-strategize, reinvest if we have to re-advocate, Evelyn, we're going to re-advocate. We're going to reinvent if we have to. And thank you, James, for that. Ladies and gentlemen, we have reached the session where it's usually very interesting. But Peter, I know you have two things that you'd want to say. I always throw you under the bus because definitely you have something to add on these discussions. But ladies and gentlemen, we're looking at, yes, we can end TB, but how do we recommit, redeliver, and reinvest? And we've opened up the session to Q&A, and we'll be taking questions. Please use your electronic hand. I've seen Imoro's hand up. Imoro, would you want to highlight something? Sorry, before I carry on.
Yeah, thank you, Lizzie. And I want to thank all the panelists for such wonderful presentations.
Oh yeah,
taken us
we're not
through
done
some-
yet.
I want to ask
yes.
a question. I want to ask a question.
Thank you very much. Yes,
I
great.
want to ask a
Thank
question.
you.
So, I want to thank them first. So my question is, Mayowa made a profound statement where he intimated that in respect of the Abuja Declaration, I think most of the heads of states have even forgotten of those declarations, and you see that that is a lapse or a gap in terms of funding for TV. So I want to suggest that this can be taken up by Act Africa and ENASO, so could research into that to know why some of or most of the head of states have not fulfilled or redeemed their declaration or whatever promise they made to inform our engagement with African leaders going forward. That's the statement I want to make.
Much. Thank you, Moro. Yes, we have to reiterate. They forgot it, and it happens. You know, like, for example, Kenya, after 5 years, it's a new government. So it happens. They drop the ball, they forget. We have to remind them they're committed, and it's high time they deliver. Peter, do you have something to add before I take Maziko's question? I don't know whether Peter which is yet, but Maziko, you can proceed.
Thank you so much for allowing me to speak, and thank for presenters. I just want to agree with Chief Austin in terms of how do we make sure that TB allocation to TB resources within the available resources is adequate. Learning from what Chief Austin has mentioned, involvement of first ladies, and I'm hearing that in Nigeria they're able to contribute about $1 billion. Was it 2 billion? I think we need to push that because allocation within countries. I think we need a lot of high-level push by our champions, like the first ladies, to make sure that our ministries of finance and health, they do make sure that they allocate adequate resources for TB. Because yes, we might have these resources, but TB is least considered as one of as a priority area. So I think using our champions, I think is the way to go. Thank you.
Thank you very much. Yes, we've seen having champions and influencers, even the amazing work that the First Lady is doing in Malawi doesn't go unrecognized. So yes, the First Ladies also do a lot of amazing work in eradicating TB, and we just need to help them in their advocacy efforts. I don't know whether Peter is still there, but we still do have time for Q&As, and I'll call Rachel because of time, just to kind of summarize and give us key takeaways. I mean, we still have 15 minutes, Rachel, but during your presentation, we'll keep on taking questions. I hope that's okay. And I'll keep on looking at the chat and the Q&A just to see if you feel like you really need to speak, do use your electronic hand, and we'll be more than happy to unmute you and give you access to speaking. Now over to Rachel. Yeah, I have to go back and get the PowerPoint presentation because it won't be justice if I don't introduce it, and I've introduced all the other speakers. So this is Rachel Otu Amponsa. Rachel, I'm sorry if I butchered the last, which I'm definitely sure I did.
You did great.
Okay. Oh, kudos. Okay, cool. So Rachel is a dedicated public health advocate focused on combating tuberculosis and improving healthcare access in Africa. And what I've come to know about Rachel is when you see her, it's hard to tell that she's that vocal, but when she starts spitting out the figures and the statistics, then you understand why she's within the TB space and also part of ACT Africa. So Rachel, over to you.
Thank you, Lizzie, and thank you for the compliments. Today, I'm going to make it short because I'm noting that we have limited space. I'd like to appreciate all the speakers for the detailed presentation they've given James for all the insight from the Stop TB partnership. Maiwa, I like his presentation on the vaccine and the reason why we need vaccine. Evelyn, one question Evelyn asked, which really aligns with me, is that she said we've been advocating for so many years. And so what do we need to do differently now? Thank you to Bertrand for your insight on financing. Austin said something. He said that advocacy is a process and not an outright thing to be done. And so we acknowledging that advocacy is a process, I'd like to reintroduce to everyone the community and civil society CSO common position on tuberculosis. And so I believe in August 2023, a group of TB, CSOs, and communities had a big meeting in Ethiopia, Addis Ababa. And one of the outputs that came out of this meeting was this paper, which has been projected on the screen. The paper basically highlights all the things we've discussed today, talking about the funding gaps in respect of TB. It talks about the vaccines. It talks about everything we've discussed today, the need for innovation in the TB space in Africa. And I need to say that the African Coalition on TB has made tremendous progress in engaging the African Union to have this document not to be just a community or African perspective on TB, but to have it as an African common position when it comes to TB. And it's also a document to have to hold our leaders, our governments, our parliamentarians accountable when it comes to the TB space. And so even though we've had a little setbacks because there have been new elections of the African Union members, but then again, the engagement is ongoing and it's been very fruitful. I'm sharing this here, and I'll urge everyone to use this document as an advocacy tool. We are not going to give up on advocacy in the TB space. Even if our governments are forgetting to do what you're doing, we are still going to come up with new things to advocate on TB space, because we know that that is the only way we can get results. And so for the countries who are on this morning, use this when you're talking to your parliamentarians, when you're talking to your government, when you're talking to those in charge, so that we can have, we can all meet the primary goal of ending TB by 2030. Lizzie, I'm noting the time, so I'm going to stop here. Thank you very much.
Thank you very much. I was actually texting just to let people know that we will share the recording of this webinar. We are going to share the PowerPoint presentations done, and we're also going to share the common position. So I don't know whether Rachel, you want to also share the link to the common position so that they can also have that already as we go? Yes, we do have 10 minutes. We can do another round of questions if there are any. If you feel like there's a burning question, but we do also recognize the comments that have been left on the chat. And of course, Lindiwe, thank you very much for reiterating and agreeing with what Maziko Matemba just highlighted. And yes, First ladies do play a crucial role, but we also need to push all the other remaining First ladies to also pick up the fight in eradicating the TB. So ladies and gentlemen, I've seen Togo in the house, I've seen Kenya in the house, people from Kisumu in the house. Thank you very much for joining. I've seen Zambia, people from Kenya, of course, people from Malawi, Nigeria. It's diverse, and you understand why, because TB is still an issue that affects a lot of people. And that mindset of TB being a disease for the poor, I mean, you've seen the first presentation we did. There's surges of TB cases in the UK and the US. It's not only for the poor. So this is a global issue. And the funding cut and the hiccup that we're facing right now is something we really need to figure out how to mitigate that before everything, kind of explodes. And we're hoping not to get there. But yes, we've spoken about having access to vaccines. And ladies and gentlemen, if there's anyone, I'll just check one more time and see if there's anybody who has a question, but I cannot see any. So that's a good thing. That means everybody actually kind of got most of the presentation that we did. I'm going to hand over the call actually to my colleague, John Baker, who's actually going to do a closing remark on the discussion that we've had, and just let us know on what next before we hang up. But before Joan comes in, I would love to just ask the speakers if you can have your video just for 1 minute so that we can do a screenshot. That would be amazing. Apparently, I need to remember doing this all the time. I keep on forgetting. But James, if you're still there, Bertrand, if you're still there, Austin, Chief, if you're there, and Eve, if we can just do one screenshot. Linda, Imoro. Sorry, guys, I know I've got you. I don't know, so I didn't give you a heads up on this. I'll just do a quick screenshot. Apparently, this really helps, and it's evidence for me to report that I actually moderated a session. So thank you very much. Appreciate it. John, over to you. Thank you, ladies and gentlemen. John, over to you.
Good afternoon, colleagues and friends. Thank you so much, Liz, for this opportunity. Can you hear me?
Loud and clear, yes.
Oh, yes, thank you. Thank you so much, colleagues and friends, once again, for this very insightful and very timely, as most of the speakers have mentioned, to discuss the issues around TB. I think we all remember TB was very heavily affected by COVID. And just before we recover that, then we have financial constraints. So this has been a very difficult moment for TB. So my name is John Beku, IANASO Programs Advisor. And on behalf of IANASO, my colleagues at IANASO, I'd like to thank everyone for this for the participation. Most important to thank for organizers. We have our ACT Africa partners, Stop TB Partnership, Global TB Caucus. We have the TTCN in Tanzania. Thank you so much for putting this together. Liz, thank you so much for a wonderful facilitation. And for the speakers, I think most of them have addressed these issues in a way that they speak to us, and they're actually very practical for what we need to do as a community. Now, from the perspective of IANASO, from our end, we continue engaging and enhancing our engagement in TB, addressing the TB challenges. And some of the things that I just want to, that resonate to this meeting and what has been discussed today, that we'll take forward and we'll continue engaging all the partners on, is one, we are going to really scale up our strategic partnership. This is one example where we bring everyone together and we move as a team in the region and beyond. So we'll strengthen that strategic partnership. We will still continue to advocate for investments, interventions, community responses in TB, in addressing TB challenges in the region and beyond. That is something that we will not stop. We will now, the most important part, as I think one of the speakers has mentioned, that we still continue to engage and we will support, is we will continue amplifying the voices and action of communities to effectively respond and also be engaged effectively in the responses at a national level. We normally do this through our development of tools, supporting accessing to resources and best practices. We'll now, I think today it was unfortunate that we didn't get to hear from the Member of Parliament, but this is also something that I think we will continue engaging the partners with. That is the policy makers, members of Parliament. That is something that we are continuing to do and carrying forward from this a lot. I think if not all, maybe 90% of what we've discussed today require the engagement of policymakers, and the push from that end. Domestic resource mobilization requires policymakers. Allocation from our national budgets requires policymakers. Even putting the right policy environment for communities require policymakers. So we continue to do that, and this is something we cannot do alone. We will continue working with our partners in that. The most important part, I think also one of the speakers mentioned, that is the gender and human rights issues. We are continuing to carry on with that and ensure within the TB communities, that the communities affected by TB and the human rights issues, the gender issues within the TB challenges, we addressed and also brought to the forefront, because we understand the only way to address the TB epidemic is to ensure communities are well engaged, and also the most affected communities, the key population within the TB, are brought to the table and play a key role in decision making and service delivery areas. We will now, the most important part, I think, we know, even with the funding, even with everybody on board, based on our experiences, we've seen technical support cannot be ignored. So we will continue to ensure that communities access technical support in addressing TB. There are a number of areas that I think we need to enhance that and ensure that we know technical support is very expensive, but how do we now come together to ensure that the technical support is available for communities to be able to have to mount a very effective TB response at country level and within the region and beyond. So having said this, I think we want to thank everybody for participation, for the good questions, and thank for your engagement. And this is, I mean, if you're looking at the numbers that of people who are here today, I think it's a demonstration that I think there is a need for this kind of a platform to bring and connect people and to address these issues. So once again, I'd like to thank all those who have played a key role in organizing this. And thank you so much, Liz, for very effective moderation, bringing out issues and facilitating to bring out some of these issues. It's not a joke. So thank you so much, Liz, for that effort. Learning Hub will continue doing this. This is one of our roles that we are engaging with the support of the Global Fund. So the Learning Hub, we also thank you, Grace. Thank you for Belinda and the rest of the people behind the scenes, Levina, for supporting and putting all this together. So Liz, thank you so much. I would like to hand it over back to you.
Perfect. Thank you. Yes, it's not over until the fat lady sings. And the fat lady is singing one thing. Not that I'm saying I'm fat, I'm just trying to put a point across. This is a shock. And this is how we're going to work around this particular shock. We're going to reinvent. We're going to talk about recommitting. We're going to reinvest and we're going to redeliver. And of course, ladies and gentlemen, this is communities and we're well known for our noise, for our advocacy efforts. GC8, they have to meet the replenishment target. We cannot afford not to push for that to be met. It has to be realized. So ladies and gentlemen, thank you very much for sparing your hour and a half. And I am returning 2 minutes back to you and look forward to hosting you in the next discussions and next deliberations. Do feel free to reach out to ENASO and the partners in case you want us to do most country-specific discussions on TB. Have a great morning, a great afternoon, and thank you for being such a lovely participant and lovely speakers. Appreciate it and have a great day. Thank you, speakers. Thank you, Bernard.
Thank you,
Thank you,
Lizzie.
Joel. Yeah.
Thank you, Lucy.
Thank you. Thank you, Eve.